It's Tuesday morning, and that means that I shouldn't be here. Well, not here anyway. I should be doing a whole bunch of admin stuff and paperwork. So, how come I'm dressed like this? Well, I gather that someone upstairs, who you all know very well, has decided today's the day to get something sorted with their teeth. So, Jill's upstairs, and I think she's up for a bit of cosmetic bonding. Okay, so today we're going to do some cosmetic bonding for you.
We are.
Do you know much about it yet?
A little bit. I know that it's fairly easily done. I think there's no drilling involved, which is always a good thing, and no local anaesthetic, which is an even better thing. So yeah, it's just this little gap I've got here that's been there, well, since I was a teenager, I think.
So here we see Jill's gap. It's obviously been there for quite a while. A little bit of a fiddly one because obviously if we make one tooth bigger, it's going to look very unnatural. So we're going to close this by making both teeth slightly bigger. Anyway, the first thing we do is we etch the surface, the enamel, with a relatively weak acid gel that does just that, microscopically etches or roughens the surface, the enamel, gives us a much better bond. That stays on for about a minute, wash the etch away. And when we wash the etch away, the surface of the tooth, when we dry it, has this matte finish to it. Now this gives us a great keying in for the bonding agent, and that's what's going on now. These bonding agents have revolutionized dentistry. It's painted on, the solvent's blown off, and then as with so many things now, it's light cured with well, it's not ultraviolet, but a blue light source. Now it goes on the composite. Now these composites come in dozens of different shades, opacities, really whatever you like. And this is where I suppose the fun, or if you like the artistry, starts. We spend quite a lot of time starting off with relatively opaque composite shades and then layering them up to more translucent shades. Obviously it's really important at this stage that we get the contouring just perfect. And I suppose it just takes time and a bit of experience. We've got some lovely materials, we've got some lovely, very, very fine instruments, so we can get it really close. These blue strips are there to make sure we don't glue the teeth together. The hygienist would never forgive me if I did that. It also allows us to get contouring really, really, really rather nice. Excess is removed. This can be a tiny bit tender on the gum, but really, really important. And again, as with bonding agents, these materials are near enough all light cured. Now we come to the finishing, which is really, really important and very, very time consuming. We use diamond polishers and then rubber polishers to gradually give us the exact appearance we want. And again, in this case, we're actually making both teeth slightly wider. So admittedly, yes, we close the gap, but not so that one notices. These are some super fine polishing strips that we actually just polish in between the teeth bit, and then we go on to polishing pastes. These come in different grit sizes and just get the whole thing absolutely smooth, immaculate, and there you go, close the gap. So yeah, one happy customer.